We're at the IAS meeting in Amsterdam. We're here with Aleksei Lakhov, who's with the Humanitarian Fund.
Action.
Action Fund. And we really appreciated you taking the time away from your work here at the conference, because we just experienced a great meeting in the press conference, I should say, that had so much in it. So much was packed in there. A lot of frustration, a lot of goodwill, and a lot of concern for LGBTQ, and also the challenges that you will face as recipient, one of the first two grantees, awardees of the Elton John. It's a community fund between that and AIDS fund, I guess. Is that correct? So I guess the first thing we need to do is get a little more background on your organization so we know more about your organization.
Thank you very much for your questions and for this opportunity to present our work here. Our fund actually has been working in St. Petersburg, Russia from the end of 1990s, and it was opened in 2001, but before that we were working together with the Medicines du Monde, I believe.
Medicines Sans Frontières?
No, this is like Doctors Doctors of the World or something like that.
Well, Doctors Without Borders is
and
Medicines Sans Frontières.
And there is another organization.
Oh, there's another one. Okay.
Yes.
All right. Okay.
Okay, and I believe in French it is like Medicine du Monde.
Okay.
And our programs are actually the continuation of their programs, so their work had a tremendous effect on our work, on our activities, and that's how we got started. And we have been operating several mobile points for injecting drug users and for sex workers. And that's
now, what do you mean by mobile points?
I mean, literally, these are buses,
oh, really?
mini buses,
wow.
or the ex-tourist bus, and we refurbished it, and now we can provide counseling there. We can provide clean needle and syringes. We can distribute condoms there.
And you've been doing that for how long?
And we've been doing it for 20 years already.
Wow.
Yes. And actually our organization was one of the first one in Russia that decided to carry out such work. And of course there were a lot of difficulties and a lot of different opinions on our work, but as I always say, we got lucky that we are in St. Petersburg, because this is a very open-minded city, and it's like a European city, and that's how we are trying to connect with our local government. We are trying to work together with them, because we understand that only in this way we can help our clients better than to oppose them or to, I don't know, constantly criticize them. So we are striving for a dialogue, not for
right. You know where you have to go, and you know how you need to get there. It's
yes.
by working in the right way. And
I hope so.
Yeah. Well, I don't envy you one bit. That's challenging. But so the program, beyond the mobile service van, so to speak, what else do you do?
We are helping our clients with restoring their documents, for example, with receiving registration in St. Petersburg so that they could receive their ARV therapy. We provide social and emotional counseling, because a lot of our staff are former drug users themselves, and they understand each other very well. And we have a lot of HIV positive people on our staff who are working as peer counselors, and they are constantly in touch with some local governmental institutions that help HIV positive people as well. And of course we have very good, I would even say excellent partners in our local AIDS center, because this is the place where...
A medical center? Or is it
yes, this is a special hospital for HIV positive people. In Russia these hospitals are called AIDS centers. And that's where we refer our clients to, And when they receive ARV therapy, we help them to maintain their adherence, mainly through counseling, some social support, and so on.
Do you do any, have you organized any support groups of any kind? Or?
We have several support groups in St. Petersburg, but they were organized by HIV-positive people themselves.
Oh, okay.
And so we like have some supervisions for our case managers, for our workers. And of course, if a client wants to have a frank, open conversation with some of our psychologists or case managers, he or she can always do it.
So do you have, what are the challenges you see facing your future with this funding that you've gotten, knowing that you're really going to have to make it work?
Yes.
You know, it's really important.
We're really gonna have to make it work. And of course, when you receive money from abroad, from some foreign donor, there is always a possibility that that you can be declared a foreign agent, and that's what we are trying to not to do. We will try not to be foreign agents.
But that won't stop you. It'll just be,
well,
you have to live one way or the other. You're going to have to figure it out. But,
yes, of course, but we are not going to engage in any political activities.
Right.
Because we receive money for our healthcare efforts. We are helping drug users. We are helping sex workers. We prevent HIV infections. Where is the politics in it?
Right, right.
So no
Right.
politics.
I think what you need is somebody on the inside of the government to make sure that they're very clear that there's any questions,
Yes.
that it's worked out.
Yes,
Before
you are absolutely right.
Yeah. So it sounds like really exciting because you want to set show where the decline of HIV,
Yes.
new infections, and it's been going the opposite way in so many cities in Eastern Europe. It's scary, as Elton John was clamoring really pretty strongly about. Do you see the real possibility that your organization alone, with your partners, can make this happen?
We can make this happen, and we have already been doing it in St. Petersburg.
Oh, in St. Petersburg.
Yes,
right.
because St. Petersburg is unlike any other Russian city, and we have more than 7 different NGOs working in the HIV field. And so there is an NGO that works with HIV-positive women. There are several NGOs that work with drug users. There are several NGOs that work with LGBT community. So it's like,
Will you be all sharing the funding, or is it most of the funding go to your organization?
No, this is the funding that goes to our organization.
Okay.
But I believe that there were several other NGOs from our city as well who applied for this funding. I just don't know whether they received it or not.
Right. Yeah. I see. So, where do you go next? What is your hopes and your challenges that you got to see in the near future?
Our main challenge is to try and convince the general public and the government officials that drug users are people. They are not criminals. I don't know. They are not lepers. They are just people who have a disease. Someone thinks that drug addiction is a disease. Someone thinks that it is not. But we are not doctors to tell the difference between these different conditions.
You might need a meeting publicized from the doctors who can explain it in the scientific terms. That'd be really helpful.
And I hope that we will be able to do it with the help of this grant as well, because we have put some media activities there, and hopefully we will be able to convey this message that drug users are not criminals, and that we help them as best as we can, and that you can help them as well.
Right.
And so that's how we want to make this happen.
Well, I definitely look forward to visiting with you again in 2020, maybe.
Yeah,
maybe.
And why not?
wherever it is, because we don't know if it'll be in our country or not.
Yeah.
But definitely see some good results, and like others have asked, even in the press conference, what can we do to help? So beyond the connecting telling people you're there for them, supportive. Whatever it is you feel you need, don't hesitate to ask. If there's help we can be, that would be great.
Thank you very much.
Thank you, Aleksei. Appreciate
Thank you.
it.